Obsessive Compulsive Disorder, more commonly known as OCD. In pop culture, OCD often refers to someone who is hyperfixated on being perfect or organized. However, the actual mental disorder is a much larger umbrella than that. While hyperfixation on perfectionism can be a form that OCD manifests in, it's not necessarily the only form it manifests in. There are a lot of common misconceptions about OCD, with there being a rise in popularity and people pretending to have OCD to seem more interesting or quirky. As someone who suffers from OCD, I want to debunk the myths and explain how OCD can manifest and the many forms it comes in, and how you can be an ally to someone with OCD. Now,
before I can move on, what exactly is OCD?
OCD is a mental illness that causes repeated unwanted thoughts and sensations, which are the obsessions, and the urge to complete an action repeatedly, which are the compulsions. Now, people with OCD get caught in these cycles of unignorable urges that cause physical and emotional distress until the action is carried out or the thought is pushed aside. And this disorder can impact all races, sexes, and ages. Obsessions are defined as unwanted, intrusive thoughts, images, or urges that trigger intense distress within the sufferer, while compulsions are defined as behaviors that an individual engages in an attempt to either get rid of the obsession or the distress felt from the obsession.
Now, OCD does not cover habits like biting your nails or thinking the occasional negative thought. That's not OCD.
Research has shown that a majority of people suffer from intrusive thoughts on occasion. However, for someone with OCD, these thoughts occur much more frequently and interfere with their ability to function on a daily basis. Now, these intrusive thoughts and actions are beyond the control of the sufferer and are often time-consuming and cause emotional distress within the individual.
There are a few general categories that obsessions and compulsions fall into, and I'll be going over the different types right now.
Side note, a person with OCD could suffer from any combination of these obsessions or compulsions. However, I will be grouping together the obsessions and compulsions that are oftentimes linked together. Now, without further ado, number 1, contamination, washing, and cleaning. Now, this is actually the type of OCD I suffer from. And the obsession within this type of OCD is contamination in any form. That could be body fluids, germs, environmental contaminants, or just even plain old dirt. And the compulsions are washing and cleaning, which could manifest in excessive hand or body washing, showering/bathing, excessive toothbrushing, or excessive toilet routines. It could also include cleaning household items excessively and avoiding doing certain activities or actions to prevent or remove contact with a contaminant.
Number 2, checking, harm, and repeating. Now, this involves the obsession with ensuring one's safety or the safety of someone that they know, and ensuring that one is not inflicting harm on another or themselves. Now, this obsession is harm, which sounds like a broad category, but usually involves the fear of being responsible for something terrible happening, like a fire or burglary, or the fear of harming another due to not being careful enough. One of the compulsions is checking. This involves the need to reinforce that one is not harming themselves or others, that their physical body is healthy, and that nothing is wrong with the world at large that is their fault.
This could also manifest in checking things like locks and alarm systems. The other linked compulsion is repeating. Now, with repeating, it could involve anything from rereading or rewriting something to repeating a routine activity such as getting up and down from a chair, or repeating certain body movements that you have, like tapping something a certain number of times. And it could also be repeating activities in multiples or repeating it a specific number of times to feel safe or good. For me, my special number is 3. I need to repeat an action 3 times to feel okay with it. Number 3, the fear of losing control. Now, this is a common obsession surrounding the idea of the sufferer fearing losing control of their own thoughts or actions. This could be anything from the fear of acting on an impulse that could harm oneself or another, to the fear of intrusive violent thoughts or horrific imagery in one's mind. Compulsions that go along with this fear could be anything from having a set of safe thoughts or mental images to think about when an unwanted thought comes into the sufferer's head, or having to complete some action to cancel out the unwanted thought. Number 4, perfectionism. Now, this is the most well-known and often the most misrepresented type of OCD. It manifests in 3 main forms. The first being an obsession with even or exactness. Number 2, a concern with remembering and knowing things. And number 3, a fear of forgetting something important when throwing out an object, which may result in the inability to make conscious decisions on whether or not to throw out or keep an object. All of these could often lead to hoarding of objects. For example, when a person loses a pen, they're normally not too broken up about it for too long. However, when someone with OCD, especially with the perfectionism type of OCD, loses a pen, it causes extreme distress and will lead to them hoarding pens out of fear of losing something important. Those have been the 4 overarching categories of OCD. However, please remember that severity varies from case to case. And all of these symptoms also need to be looked at in terms of function and the context of the behavior. In a majority of cases, people with OCD would rather not engage in these time-consuming and often torturous acts that take away from their ability to function in society. At the end of the day, I ask you to approach all people with mental illness with empathy and understanding, and please do not mimic their symptoms and minimize their experiences. Thank you.